Sound advice to keep your body and mind in perfect harmony. You're tuned in to the Dr. Steven Show. Now, here is Dr. Steven Eisenberg.
Hey everybody, welcome to the Dr. Steven Show. We're so glad to have you with us today. I have a super guru with us today. Her name is Dr. Izabella Wentz, PharmD, founder and CEO of thyroidpharmacist.com, and she has only created the best and brightest Facebook group in the world on Hashimoto's thyroiditis, hypothyroidism, and any thyroid disorders. She is just one of the most incredible people that I know. I've had the pleasure of meeting with her, of being on her show, and I'm so blessed to have her with us today. Did you know that thyroid disorders are way underdiagnosed? And in fact, listen to this. Our cameraman, who I'm not going to bring out here because he said no, but just told us he has hypothyroidism. Today, like 5 minutes ago. I'm telling you, this is happening all over the world, underdiagnosed, and I had to tell you, I'm looking at you, he's not taking his thyroid medication. Now, my guest today is a New York Times best-selling author, Dr. Izabella Wentz, PharmD, and we're going to get into it. We're going to talk about thyroid, we're going to talk about hypothyroidism, Hashimoto's, all of it. And she's going to see if I have a thyroid disorder, which I might, right? I mean, look at my hair. I mean, she's going to examine my hair. Hello, I just like shaved off the sides. I know it looks sort of silly, but hey, we are here. We are going to get into the thyroid, and we'll see you in a minute with Dr. Izabella Wentz. Come back. We'll see you soon. Bye.
Because you need to know.
Because you need to learn.
Because financial planning can be complicated.
There's wealthed.com.
Wealthed.com.
The site dedicated to educating you about financial planning.
With guidance from experienced financial planners.
Helping you learn more about creating your financial plan.
Watch Bucket Strategy Investing, presented by Lucia Capital Group, every day at 1 p.m. Eastern, 10 a.m. Pacific. Or watch archived features from the show on demand. Learn more about options for your benefits on the Social Security Show, every Tuesday afternoon at 4 p.m. Eastern, 1 p.m. Pacific. Lucia Capital Group brings you Bucket Strategy Live, Wednesday evenings at 9 Eastern, 6 Pacific.
And learn more about the challenges women deal with on Femme Finance, Thursday afternoons at 4 Eastern, 1 Pacific.
It's the site where understanding financial planning can start to click.
Click on wealthed.com.
Live programs, on-demand archived features, and articles.
Go to wealthed.com.
Wealthed.com.
And we're back with Dr. Izabella Wentz, PharmD, New York Times best-selling author, and I like to call her the guru of all things thyroid. Here's her amazing book, What's Really Going On? And I really want to know what's going on with the thyroid, with all of it. And it's called Hashimoto's Thyroiditis, Lifestyle Interventions for Finding and Treating the Root Cause. And that is the key, the root cause, because it's underdiagnosed. And I want to just thank you for being here.
Thank you so much for having me on, Dr. Steven. I'm so excited to be here with you.
Now, I want to first find out about the root cause, because this is really where it all starts. And it's underdiagnosed, and Hashimoto's is way underdiagnosed. Our cameraman just told us that he, in fact, has it 5 minutes ago. Tell me how this all came to be, your journey, so to speak. How did it go from I'm a pharmacist and now I'm the internet's most popular thyroid guru? Please tell me.
Well, so in full disclosure, Dr. Steven, I was never interested in the thyroid during pharmacy school. There were just so many other conditions that seemed more interesting to me. There was oncology, which is your specialty. There was psychiatrics, and everything else just seemed so much more interesting. There were so many more medications out there for these other types of conditions. So I didn't become interested in the thyroid until I was diagnosed myself. And that's when I became a Hashimoto's expert / guinea pig, because there really wasn't a lot of information out there about what you can do other than to take Synthroid,
right,
which was the #1 prescribed medication in all of the United States in 2013 and 2014. So, but
That's crazy.
When you are diagnosed with a thyroid condition, you're
What
told...
happened to you? Like, how did you feel when you were diagnosed?
So we'll go into that in just a sec, but
Got it.
what happens is that people are just told that they can only take Synthroid and that's all there is to it, yet people continue to struggle with a lot of different symptoms and they don't get better and they're not addressing the root cause. So I really wanted to figure out what I can do to help myself and then help others with the condition. So my story was,
I love it.
I was a bright-eyed and bushy-tailed kid and bright-eyed and bushy-tailed college kid, high school kid, until my freshman year in college when I came down with a viral condition. It was likely Epstein-Barr virus. And after that, I just kind of was tired all the time. So I was sleeping 12 to 14 hours each night. And my health just started to decline after that. So I ended up with brain fog. I was forgetting words like cat. I was wearing 2 jackets in the middle of Southern California because I was cold all the time. I was having carpal tunnel in both arms. I was having panic attacks. I was losing my hair, which was a really big deal for me as a young woman.
Of course.
And just had this plethora of very odd symptoms. And I would go from doctor to doctor and say, hey, something's off about me. And
what did they say?
well, they said a lot of different things, and some of them didn't make a lot of sense. One of them said I was getting older. I was 25.
Yes, you're just, you're very old, let me tell you.
Right, and then others said, well, everybody's tired, everybody's stressed out, everybody's losing hair, so, you know, it's all, or the other one was it's all in your head. And then I also got offered a lot of drugs.
Yeah,
so.
the old, it's all in your head. And what did they give you? They gave you Synthroid?
They wanted to, so they didn't know about my thyroid condition. I was complaining of brain fog and low energy, fatigue, and they said I should take an antidepressant for that. And I was like, but I'm not depressed. I'm actually happy in life, so this just doesn't seem to make sense.
I'm just tired, Doc. I'm not like depressed, so why take Prozac?
Exactly, exactly. And I was, you know, I had just started working as a pharmacist then, and
I'm sure they gave you, you're stressed out, you have a new job, you're...
Totally. I had to take the boards, and I just got married to my wonderful husband, and we had moved across the country, so there was a lot of different things going on. And I also learned that not all doctors are created equally. So some doctors will do more comprehensive testing than other doctors, and I ended up going to a really good doctor who did the right tests that I needed to have done to figure out that I actually had a thyroid condition. So
what did they do? TSH, T3, T4? I mean, did they do anything above and beyond, or just your sort of basic thyroid panel?
So I had done the basic thyroid panel almost every year for a decade and was told that my thyroid function was normal. I now encourage every patient, if you have a lab test done by your doctor, to always ask for a copy of those lab tests and do your own research. So I was told that my TSH, my thyroid function test, was normal, when in fact it was elevated, which meant that I was hypothyroid. So a woman around age 25 should have a TSH somewhere around 1. Mine was 4.5, but yet the reference ranges that the doctor's offices and the lab was using at the time thought that was normal, and I felt like a sloth. I was sleeping all day, I was taking way too many naps, I was very brain fogged, so I would walk into different rooms, I'd get there, and I'd just stare, and I'd be wondering, why did I come in here?
Takeaway point number one. Takeaway point number one. Within normal limits doesn't always mean within normal limits for you.
Absolutely.
Is that what we're saying? Because you were within the range, but your symptoms spoke differently.
Absolutely. And so the reference range, and this is kind of an interesting little nerdy fact, but when scientists...
I'm a nerd, it's okay.
Yeah, we're among good company.
Yes.
When scientists first determined the reference range for TSH, which is the screening test for thyroid disease, what they do is they basically take a bunch of people's blood and they, mix it all around, and then they figure out what the average is, right? Well, when they did that, they actually had people with thyroid disease in that healthy pool of blood. So then the reference range was very lax. And so they were saying if your TSH was as high as a 10, you had normal, healthy thyroid function, where we know for a healthy person, it should be somewhere around 1, maybe 2. Anything above 2.5 is when I began to suspect thyroid issues. And then the other thing is the TSH may be normal for a decade, sometimes even more.
Wow.
While you have this thyroid process, this autoimmune thyroid process happening in your own body.
And
so
it's subclinical. No, it's not subclinical. You can't see it on the labs, so to speak.
you can't
but
see it on the
feeling
TSH
it.
labs, but you can feel it in your body. And it's been
Yes.
associated with so many different symptoms like hair loss, fatigue, anxiety, panic attacks, weight gain, a lot of these different things when the TSH is normal. So what we're going to talk about a little bit more is the primary cause of thyroid disease in the United States, and that's going to be due to autoimmune disease. So basically, the immune system decides that your thyroid is the enemy and begins to launch an attack. When this happens, about 90% of the time, we can actually measure antibodies to our own thyroid gland in the blood. So that means that your doctor can run more advanced testing to figure out if you actually have an autoimmune process going on in your body before you see a change in TSH. So when the immune system starts to attack the thyroid gland, year after year, you're going to destroy more of your thyroid tissue. If you can find it early, it's a slow process.
By the time you're already feeling it, it's almost like the damage has been done.
The damage has been done. But if you find those antibodies early, you can prevent the damage. In some cases, you can regenerate tissue, but it's a slow process, and it's much harder to regenerate thyroid tissue than it is to prevent damage, of course.
So takeaway point number 2, I would say, is be aware that A, you have a thyroid, for those that aren't really, conscious of their thyroid, and B, start getting tested early. I mean, be aware of the symptoms so you could prevent, a worse problem later in life. And they could take some of these lifestyle changes into effect at any time, couldn't they?
Yeah, absolutely.
And you go, this book is so comprehensive. New York Times bestseller, first of all. And second of all, you can get a free chapter if you go to thyroidpharmacist.com/gift. Do that right now, everybody, and get your first chapter. I read this, you sent this to me months ago, and I'm glad you did because it's so comprehensive. I had to take my time. It's easy to read, and I loved it. And I was wondering, wow, maybe I have, and I don't go to the doctor that often. Is that?
Well, you are a doctor.
I am, I know, but it's notorious. Doctors don't go to doctors, and we try to take care of ourselves. I have to tell you, I probably have never had a TSH done in my life.
So we have a
Not that I'm aware of anyway.
So we have a to-do list for you. So definitely if you have a family history of thyroid disease, so if you have mother, grandmother, especially if you have a father or brother with thyroid disease, that's going to predispose you to be more likely to have Hashimoto's or another type of thyroid condition. So any family history on either side, you want to get your thyroid checked.
Yeah.
Let's get into symptoms. You want to talk thyroid symptoms and what people at home could be looking out for?
Absolutely. I mean, this is what the show's about. We want people to leave with actions that they can look at in their own lives and try on for a week, and if it fits, they can wear it for the rest of their life.
Absolutely. So let's talk about, we're going to go from kind of head to toe with thyroid symptoms.
Yes.
So obviously you do want to get testing with your doctor, TSH, thyroid antibodies, TPO and TG antibodies. But, if you're sitting at home and if you're wondering if you have this thing, let's kind of go over. So starting with the hair.
I'm the sort of the guinea pig now.
Yes, you
All
are
right.
the
Now,
guinea pig.
let me tell you, I'm scared because A, my hair is crazy, as you might see. It's brittle. It's sort of a what I call a Jufro.
I like that.
Yeah, and so I don't know if you can really use my hair as a normal, because I'm hyper, but I also have this gut, and that many of my guests have been trying to obliterate, and I'm trying to take on their tutelage. So. So start with the hair. What do you think?
Okay, so we want to look at the hair, and we want to look at texture and whether it's falling out. So a person with...
That's the gel.
Now we just messed it up. So a person with an underactive thyroid is going to have a higher likelihood of losing hair. So they're going to be shedding more hair. If they're in the shower, they're going to see hair on the wall, hair in the drain. Some of my clients have described it as having a rat at the bottom of the tub.
And is
after
this
a
even
shower.
guys? I mean, is this like different than male pattern baldness? Because can men, because mine's probably a combination of male pattern baldness and, taking a strand of hair here and pulling it down, wearing hats all the time.
So that's a really good question because with different patterns of hair loss, you may have patches, alopecia areata is when you have a big empty patch of hair. With thyroid hair loss, it's diffuse. So that means it's all over your hair. It's all over your head. So it's not like you're just you're not just getting a bigger forehead and you're not getting a weird patch somewhere. It's everywhere.
Yes, I call it my 5 head because you can see a forehead would be here, 5 head is another inch. So I think you're right. It's not really I'm not having it all over. It's just sort of here and there and everywhere. But
And then hair that's more brittle and more difficult to brush, that can also be a thyroid symptom. So one of the early signs of having, if you have straight hair, this is especially important. If you're a woman and you're having trouble brushing your hair, it's becoming more tangled. That can be a sign that your thyroid function is off. And it could be, anything, whether it's underactive or overactive, your hair is going to be affected.
interesting.
So that's a really important thing to look at. The other thing is looking at your eyebrows. So your eyebrows look nice and filled in.
Can we get a close-up of the eyebrows? I'm kidding. All right. So what did they tell me?
People with thyroid conditions, what can happen is they can begin to start losing their eyebrows. And the upper third part of the eyebrow, so like right here, if you start losing this part, that is a really good sign that you may have thyroid disease. That's kind of one of those specific signs of thyroid.
All right. Am I losing it?
It's hard to tell in this light. Do you have makeup on?
No, not really. But what do you think?
One thing I would recommend is looking at old pictures of yourself and seeing whether or not you have less eyebrows now. Because it's one of those things that if you've plucked your eyebrows, or some people are born with a lot of eyebrows, others are not.
Yes.
So that's
Unibrow.
something to consider. Yeah, some people have a lot more eyebrows than you and I do as a starting point. So it's really, you're looking at, what was your baseline and how has that changed.
Awesome.
The other thing that we were going to look at is your eyes. A person with hypothyroid or an underactive thyroid is going to have puffy, swollen eyes.
Yes.
A person with an overactive thyroid, a lot of times they may have protrusion of the eyes or eyelid retraction. So their eyes
exophthalmos.
Exophthalmos, exactly. So their eyes are going to be bulging out of their head. And of course, this is all, it's all going to be relative. So you want to look at your baseline. Some people have naturally sunken in eyes, others have naturally bulgy eyes. So you want to look at, has your face changed? And a lot of times
look at old pictures. Takeaway number 3. Look at old pictures. Look at your hair. Look at your eyebrows. Make sure that you are watching for any changes. And when we come back, we're going to go through more symptoms of thyroid disease with Dr. Izabella Wentz, and we can't wait to hear what else we should be looking for and get into some of the lifestyle interventions. We'll be right back with Dr. Izabella Wentz. Come on back, everybody.
It's the site where understanding investing starts to click. Click on wealthed.com, educating you about financial planning and answering your most important questions with live interactive shows hosted by experienced financial strategists and an on-demand library of videos and articles you can access anytime for free. Wealthed.com brings you retirement planning guidance, social security strategies, tax management techniques, portfolio allocation options, and more. Your source for information and financial education, online, on demand, on wealthed.com.
And we're back with Dr. Izabella Wentz, PharmD, and New York Times bestselling author of The Root Cause. I want to get into lifestyle interventions later, but let's finish the list. So we have a bunch of takeaways already, because you're awesome, and thanks for being here. So my hair, my eyebrows, my eyes, they're probably puffy. I mean, we've got 3 kids. Honey, are you watching? I mean, I stay up too late probably. So I have everything. I've got the brittle hair, but that could be,
could just be your type of hair. So let's go over some of the other symptoms.
Yeah, tell me.
So going back to your face, if you have dry skin, if you have a pale skin color. For men,
pasty,
yep.
Pasty.
Peaches and cream complexion. So.
Oh my God! Have you watched? For those of you at home, yes, the hair, the pastiness, the Play-Doh complexion. I'm fitting everything so far.
Okay, so yeah, so far we're getting a high score on this assessment.
Go ahead.
So we're looking at your face, whether or not you have dry skin. For men, sometimes they may have trouble growing beards. Women have trouble in the opposite direction, where they grow hair on their face when they're not supposed to.
Got it.
With thyroid issues in some cases. Looking at your, we're kind of on the head, so let's talk about brain function. People with thyroid issues, they may feel anxious. That can be a sign of an overactive thyroid, and sometimes at the beginning stages of an underactive thyroid, you'll see that happening.
Yeah.
They may be depressed. They may have trouble with motivation, and they just may not feel very motivated, and they may have brain fog.
Yes, well, we talk about that all the time with chemo.
Yes.
Chemo brain, well, there's thyroid brain,
Right.
hypothyroid brain.
Absolutely.
Where you're just having problems like finding a word or remembering somebody's name, some simple thing like that, right?
Exactly. And then anxiety is a very common thing where somebody will have new onset anxiety. So I like to tell a story before I was diagnosed, I was really anxious, and my husband would go out running and he'd say, I'll be back in 20 minutes, and 25 minutes would pass, and I'd be like, hey, where is he? What happened? Did he get hit by a car? Did he fall off the side of the cliff? Or, did he run off with another woman in the last 20 minutes? And it just wasn't rational.
Please. No, but I bet a lot of women are just, diagnosed with anxiety.
Anxiety, and
Take a Xanax.
Take a Xanax or take a
Vitamin
Prozac.
X, here you go. Write the prescription, right?
Sometimes even things like Seroquel, they're given, heavy-duty antipsychotic medications. And so that's a really important symptom. Anytime somebody has new onset mental health issues, I highly recommend getting your thyroid function tested, because early stages of Hashimoto's can resemble panic attacks. They can resemble anxiety disorders. They can resemble obsessive compulsive disorder, bipolar disorder, and I've even seen some people who were hospitalized for psychotic disorders. And it's basically, when you think about the thyroid, it can stimulate you. It can make you really anxious and irritable.
Like
when
manic.
you have too much of it, manic. So that's something that I really, really recommend for people to do whenever they're struggling, have family members or friends. Sometimes it could be a thyroid problem, not a mental health problem.
Yeah, so I noticed that a lot of the primary docs in the community are really getting more and more focused on the thyroid. That they're
so grateful for that.
Yeah, they're just ordering it almost on everybody, where when I first started, it wasn't as prevalent. So I think you're getting the word out. I think people are standing up for their, being their own advocates, power to the patient.
Yes, absolutely.
Right? And that you talk about that, right? Be your own advocate. And there's a lot of that in the book about you have to sort of take a stand for your own health.
You do. You really have to be your own health advocate. Doctors are out there to help us. Every single doctor I've ever met has wanted to help every patient that they know. But there are certain things you can't be, primary care doctors, what's the average time they get to spend with a patient?
10 minutes.
10 minutes, and they have to cover so many bases. And then they have all these restrictions from insurance companies where they're discouraged from doing certain diagnostic tests and so on and so forth. So, as patients, we really have to work hard on finding a doctor that we're very comfortable with, that's willing to listen to us, and that's willing to take us seriously. One of the things with thyroid issues is that for every man with a thyroid condition, there will be 7 women. This is a condition that seems to be somewhat connected to hormone fluctuations. They can bring on the condition. So puberty, pregnancy, and perimenopause are 3 times when we see peak times when women start having more thyroid symptoms. And unfortunately, the truth is that sometimes women are just not taken as seriously as men. And you said, doctors don't go to doctors, and men don't usually go to doctors, but women will often reach out to their doctors, and a lot of times, unfortunately, they're considered hypochondriacs when they're the ones that know their bodies best. So if you're somebody that you're sitting at home and you're feeling like you have some of these symptoms that we talked about, or just something's not right, you need to find a doctor that will listen to you and that will really care for you. So don't let somebody else stand in the way of of getting your health back.
Yeah, listening is the number one thing when it comes to being a doctor, I believe. I mean, because there's so much out there that you can use to help with your diagnosis, and I love things like uptodate.com and things like that. But listening and that human connection and really just being with that other person across from you is huge. And that's just it's a great cause that you're standing for. Tell me about have we gone through all of the possible conditions? Symptoms?
You're not off the hook just yet. So.
Oh my God, okay. What else so I'm pasty, I'm balding.
So let's talk about actually the neck. So the thyroid gland is located at the base of the neck, and some people,
right here.
Yeah, it's going to be under your Adam's apple. So in some people, they may have an enlarged thyroid gland. So this is rare. Goiter. So we don't see this as often. Goiter was, back in the day, the primary cause of thyroid disorders was iodine deficiency. Now that we have iodine added to our salt supplies in most westernized countries, the primary cause is actually Hashimoto's. And you don't necessarily always have an enlarged thyroid gland with Hashimoto's. There's two types. In one type, the thyroid shrinks. In another type, the thyroid enlarges. And so one thing that you can do, and I recommend that everybody does this at least once in their lifetime, especially women of childbearing age, because thyroid function is so, so, so important for proper development of the baby, and making sure that they have, that you can get pregnant, that you sustain a pregnancy, and that your baby is born healthy, is making sure you get a thyroid ultrasound. Because sometimes you may not be able to see it on blood tests, but you can see the changes consistent with thyroid disease on a thyroid ultrasound.
And you may need even a biopsy.
In some cases you may. So if the doctor finds nodules or something that looks suspicious, potentially, your specialty cancerous, you may need to have a tiny, tiny little needle inserted into the thyroid gland so that the doctors could look at the cells under a microscope and figure out whether these cells are benign or if they could cause trouble.
Yeah, and we give radioactive iodine sometimes to patients with thyroid cancer as part of the treatment. So that's just a whole other, that's for another episode.
Yeah, that's for another episode, all of the different treatment options for the variety of thyroid conditions. But so let's not change the subject. We're talking about you here, right?
Yeah, I was trying to dodge it a little, but I really want to know. So please, what else? What else do we have?
So we're looking at your body weight. So if you tend to be overweight.
I'm kidding. Yeah, well, I've done a little bit better since we had JJ Virgin on.
Yes.
I've gotten a little bit better.
Good.
Got a little shout out to JJ, but I've gotten a little bit better. I've been journaling what I've been eating.
Good. You're looking great.
Oh, well, thank you. But but I do struggle with this. Say hello to my little friend. This right here. And so I do have this middle Pillsbury Doughboy physique.
And so that's one of the things that can happen in thyroid disease and thyroid conditions. If you have an underactive thyroid, I often give an example of two best friends. They're both going to the gym together and they're eating all the same foods, yet one of them, if she has a thyroid condition, is going to keep putting on weight. And she's going to have a difficult time losing weight.
And they're both working out the same,
and they're
eating
doing exactly the same thing, because the thyroid gland controls our metabolism. So it generates, it helps us burn calories for energy. And so when you have low thyroid function, you're not going to be burning calories as quickly. So generally we need a certain amount of calories per day to keep us alive and to sustain our body's metabolism. When you have thyroid conditions, that gets suppressed. So you can be eating, carrots and salad every day and exercising 3 hours a day, and you can be putting on weight because your basal metabolic rate is going to be very, very low compared to the average person. So you're going to need to, you basically, if you were in a famine, you could survive. And what's interesting is that people, a lot of people of Irish descent have thyroid conditions because during the potato famine in Ireland, the people that survived were the ones who had thyroid conditions, undiagnosed thyroid conditions, because they didn't need as much food to keep them alive.
That's fascinating.
And so perhaps,
I love stories like that where you can, was it sort of this phenomenon that occurred to help them
Right,
survive
evolutionary,
almost?
right, evolutionary physiology.
But
That
now we
maybe
don't need that.
we don't need that. We absolutely don't need to be holding on to our calories, right?
Right.
Yeah, we need to be at a healthy weight and burning that. And so the flip side of that is in hyperthyroidism, people can lose scary amounts of weight within a very short amount of time. They can, I've seen people who've lost 5 to 10 pounds within a short course of a few weeks. And they often feel agitated and they have palpitations and they just don't feel so good. The other thing that we're thinking about is whether you're dressed appropriately for the weather. And we're in sunny San Diego here.
Yeah.
And so I'm wearing this little dress and you're wearing a sweater.
Yeah.
So
This is my busy sweater.
Yes.
It's part of my new look for the show.
I like it. It's nice.
But you're right. I do tend to get cold. Is that? Yeah, maybe that has something to do with my thyroid.
That is actually a really big, one of those giveaway thyroid symptoms is that you tend to be colder than everybody else in the room. So if you're a woman that's working in an office and all the ladies are in short sleeves and you're wearing a sweater and a scarf and you're shivering, at the lunch table, that's an indication that potentially your thyroid is not working well enough, and because you're not burning that energy for generating heat, because that's what the thyroid does. As it burns calories, it generates heat.
Yep.
So
interesting. No,
yeah.
I mean, it's fascinating. The thyroid does so much.
It affects every cell in the body.
I want to let's get through the rest of these quickly, because I want to get into some of the interventions that people can take on, like right now in their lives.
Sounds good.
Yeah. So what are the other things that people should just be aware of?
Cold hands, cold extremities, palpitations, swollen tongue, any kind of swelling in the body, any kind of mental health disorders like I mentioned. A swollen tongue is an indication. If you have bite marks on the side of your tongue, that could be a potential symptom of having an underactive thyroid. Generally fatigue, weight issues, hair loss, and then
Sleep?
brain
what about
fog.
sleep?
So it can
Are
be.
you sleeping long? Like you said, you were sleeping these long hours.
You can be sleeping hypersomnia. So oversleeping can be a symptom, as can insomnia.
My wife was just telling me that I sleep too much, and that could be part of it as well.
Yeah, that sounds potentially.
I've got like 5 or 6 things on this list.
Yeah, you have quite a few on that list. So I would recommend that you see your doctor or see your lab, however you do it, and make sure you get tested
Will
for
you
TSH.
order those tests for me?
Oh, you can order them yourself.
All right, I'll order them. I can do it. I can do it.
There you go.
Now, suppose I actually have it. Okay, suppose, let's just take the leap of faith and say I have an underactive thyroid, which would explain a lot. What are some things I can start to do, lifestyle interventions, that can help the root cause? Like they're all in the book, so get the book, everyone, but what can people who are watching who have a low thyroid do right now? Today.
So without your doctor, so there's a ton of information there about getting on optimal thyroid medications, which in some cases are going to be necessary and very helpful. And Synthroid is not the best medication for everybody, so I find that majority of people that I correspond with or that are my clients that have come through my pharmacy or that have come through my programs or consulting.
There's other options.
Yeah, they do better on different types of medications that perhaps contain a mixture of thyroid hormones, not just one thyroid hormone, which is what Synthroid has. But the things you can do on your own without needing your doctor's supervision are going to be really looking at your nutrition. So what kind of food are you eating? Majority of people that I've surveyed and that I've worked with, 90% of them are going to feel much, much better off of gluten. So I've seen miracle stories. So
No grain.
No grains, no grain, no pain. But I've seen miracle stories of women. I had one woman who was an equestrian, and she lived on this gorgeous farm with her horses. And she wrote to me after reading my book and said, "Your book has changed my life. I, changed my diet the way that you recommended. And for the first time in 5 years, I have enough energy to take care of my horses and ride my horses." So this woman loved her horses, but had to pay somebody to take care of them and wasn't able to ride them for almost 5 years because she was so exhausted. And just changing her diet up resulted in her having her passion back.
And I bet she didn't have to take as much thyroid medicine.
Oftentimes that happens.
I wonder if you
Oftentimes
could
that
come
happens.
off of certain medications if your thyroid, if you're just getting better and better from diet and exercise and some of your other, what's another one that people can do?
Another one is getting off of dairy. So dairy is probably the second biggest trigger for people with thyroid issues. About 80% of my people feel much, much better off of dairy. And so you'll see things, my story is I had irritable bowel syndrome and I had acid reflux. My acid reflux kept me awake most nights because I would wake up coughing. Sometimes I'd be talking to a patient at a pharmacy, I'd have to start coughing so hard, I'd have to run back and vomit in the bathroom because I had this horrible acid reflux, and I was on over-the-counter medications, I was on prescription medications, I was doing the recommended acid reflux diet, doing all those things, nothing helped for 3 years. 3 years. And within 3 days of getting off of dairy, gone. My acid reflux, I haven't had it for 5 years. I'm off of every single acid reflux medication. And it was just a miracle story. And these are the things that happen when people just switch their diet around.
So 2 easy things: no gluten, no dairy.
Right. And then I actually have a guide how to go gluten-free and dairy-free on my website under the thyroidpharmacist.com/gift to make it really easy for you, because there's really simple substitutions.
I want everyone to go and download that right now, because it's going to help your thyroid first of all, but I think that can help other issues as well.
It could prevent disease. So you can slow down the progression of the condition, you can reverse the condition. Like you said, some people are able to reduce their dosage of medications, others can come off of the medications. Either way, everybody feels better whether or not they stay on their medication. So this is something you can do in addition to working with your doctor.
And how can people work with you one-on-one or in a small group? Or can they go to thyroidpharmacist.com and actually engage you and start working with you if they have an issue?
So what they can do is I have a pretty engaged Facebook community, and that's where I do most of my interaction. If they look for Dr. Izabella Wentz, thyroid pharmacist on Facebook, they can kind of chat with me there. And they should sign up for my email list, where I send in weekly tips and suggestions for overcoming Hashimoto's and kind of break it down for people so it's a little bit easier. And I also have a group program that I run a couple of times a year where people can get in and really learn how to take care of themselves, so that they can just take charge of their own health and kind of hack themselves. It's called Hacking Hashimoto's.
I love that.
That's what I call it.
Hacking Hashimoto's. Again, the book is Hashimoto's Thyroiditis: Lifestyle Interventions for Finding and Treating the Root Cause. I want to end the show with a little thing that I do. And it's a song. Yes, it's a song that is for you. Here's the lyrics, and I'm going to play it for you, and then we're going to end the show. So here is your song, and the words are by me, and the music is by James Taylor. So here we go. And it's just a little tribute, because you're making such a difference in so many people's lives that I wanted to give this little gift to you, and you deserve it. And all right, so it's to the tune of Gone to Carolina, but it's gone to Izabella. Okay?
I love it.
My thyroid, sorry. My thyroid, wait, hold on. My thyroid, hold on. We'll edit that out, hold on. My thyroid gland, there it is. My thyroid gland needs help from Izabella. Got Hashimoto's, and I don't know where to go. Ain't it just like a gland of mine to hit me from behind? Yes, I'm gone to Izabella in my mind. Yes, I'm gone to Izabella, and health I'll find. Anyway, so that's the little song. And thank you for being here. Go to thyroidpharmacist.com, everybody, and learn about your thyroid. Take action. Join her Facebook group and get into action about your thyroid. And thanks for being here. And I can't wait for everybody to read your book and really get all the information they need.
Thank you so much for having me here. Thank you for the work that you do and for this beautiful song.
You're welcome. Come back, everybody, next week for the Dr. Steven Show. Bye.
It's the site where understanding investing starts to click. Click on wealthed.com, educating you about financial planning and answering your most important questions with live interactive shows hosted by experienced financial strategists and an on-demand library of videos and articles you can access anytime for free. Wealthed.com brings you retirement planning guidance, social security strategies, tax management techniques, portfolio allocation options, and more. Your source for information and financial education, online, on demand, on wealthed.com.